They are usually one of the firsts at the scene of an emergency. And it's no different in these COVID-19 times for Halton Region Paramedic Services. Madison Brydges has been a paramedic for 8 years. She says in some ways they've had to adapt.
We're used to diversity of calls. We're used to people calling us for a whole bunch of different reasons, and that definitely hasn't changed. And the care that we're able to provide for people hasn't, but definitely right now with everyone's heightened concern over the COVID-19 situation, I think it's really amplified our role in many ways. And I think paramedics have really been adaptable to quite a number of different things that have been thrown our way in the last few months. For instance, some of our community paramedics are doing swabbing now in long-term care and in people who can't get to an assessment center. So I think that's a really important role. But then just the rest of the time that all of us that are on the trucks 24/7 that are still continuing to connect people to further care, whether that's in hospital or whether that's other care in the community.
These changes also include new protocols. Brydges says it has impacted response times, safety measures, and to some extent, their mental health.
We take a bit longer, unfortunately, to get to people. We have to take a lot of time to put on a lot of personal protective gear. We have masks, we have face protection, gowns, gloves, and I think that's one of the biggest challenges for us and probably for the people we serve is, we're sitting in your driveway for an extra couple minutes there just to make sure that we're safe and that we're able to provide that care. And then for us, there's a lot of cleaning. A lot of cleaning's happening pretty regularly throughout the day, and we also have to ask the patients and places we go a lot more questions about if they have any symptoms of COVID-19, just so we can communicate that to the other hospitals that we'll ultimately take them to. It's definitely different. I think probably myself, like probably many others, there's been a lot of information and a lot of unknowns, and that definitely created a certain level of stress for all of us, including members of the public and for the patients we've seen. And in long-term care and other institutional settings have really been hit pretty hard with COVID-19. So I think for myself, I definitely feel my heart goes out to them because that's been really challenging to see.
But despite the added pressure to serve the community in a pandemic, Brydges says the outpouring of public support makes the job she holds dear all worth it.
There's been lots of grand gestures of some really amazing meals and food that's been brought in, but even just some simple things of, we driving around doing a standby or going to the hospital, having, small children give you a wave, or the other day, an older man was crossing the road and stopped. He came back and emailed him thank you. So, those things, I think, even those little gestures, I think go a really long way. It means so much to know that our community supports us.
So much so that some call frontline workers heroes. When asked how she felt about being given such a title, Brydges couldn't help a modest laugh.
I think that's a challenging term sometimes because, we're very proud to serve in this role and to do this job. I have an immense amount of pride in myself and my coworkers for sure. I think for all frontline workers right now, I think across the board, whether you're working in a long-term care or a grocery store or another essential service, that everyone deserves that label right now for sure.
Reporting for Halton News, I'm Melissa Candelaria.